All right, I think the team from Rwanda is here. Is the team from Weber ready?
I think they're here and they're ready.
All right, then I guess we can start. So the agenda for today. So first of all, Jean-Michel couldn't make it because he got some meeting he's quoted in. It was an emergency meeting. And then also, for some reason, I won't be using my video because we don't have, we have a electricity problem here. So yeah, so I'll be hosting the event. So my name is Bangali. I'm the regional coordinator at iDebate, right? And I think I will have some time to explain what iDebate does for those who don't know. So the agenda for today is we're gonna have a welcome remarks. We're gonna have an introduction of the Weber State debate team from Samuel Allen or any representative from Weber State. And then from there, we're gonna have an introduction of our team from Rwanda, from iDebate Rwanda, introduction to the topic. We'll go straight, dive into the debate. And then from there, we're gonna have a Q&A for any of the people that are watching us both here and on YouTube. I hope you guys can still hear me. And then from there, we shall close the debate. So yeah, we welcome everyone here on behalf of iDebate and on Weber State side. This is our global debate series. So it's a series of debate that we have with different universities, mainly in the US, especially those that we have had the US tour at. And Weber State is one of our partner universities we have worked with before and have had the tour there for at least several years. And we're glad to have this debate with you and this kind of partnership with you and hoping that it keeps on growing. So yeah, so I think from now we're gonna have a representative from Weber State to welcome and introduce to us the team from Weber State.
Hi, everybody. Hopefully all y'all can hear me. We're super excited to get to work with Rwanda. It's neat that we could keep doing this partnership, even if it's a little different this year. On the Weber side today for the affirmative, our first speaker is going to be Jordan Stevens. He is a medical laboratory sciences major, and he's been with us for 4 years now. And our second speaker for the affirmative is going to be Bailey Brunier. He is a political science major and has been with us for 2 years. So they're both super neat, and it's going to be super exciting today.
Okay, thanks very much. And from there, so today we have a team Rwanda as well, like a team from iDebate Rwanda. We're gonna have Audrey and Joel debating with us today. These are some of our students, but they're part also of the alumni group. And they will introduce themselves as we dive into the debate. Guess they're glad to be here. So the topic today that we're going to debate on is whether the vaccine is should actually be compulsory. So there's been great debates about it all around the world, here in Africa and all around the world, of whether is this the right vaccine, is this the right decision, why should it be compulsory, should someone have maybe the right to choose to have it or not. So that's what we're going to debate about today, and we hope to have like great insights from this debate. Yeah, so we're going to dive straight into the debate. So the first speaker from the affirmative. So Rwanda is on the negative side and Weber State is on the affirmative side. So the first speaker from the affirmative side is going to have 6 minutes, and then we're going to have cross-examination of 3 minutes. And the first speaker from the negative side as well, 6 minutes. Second speaker, 6 minutes. And then we're going to have the closing speeches are going to be 4 minutes, 4 minutes. So all the time after speaker, we're going to have 3 minutes for cross-examination. So yeah, are all the speakers ready? You can just put a thumbs up in the chat box, something. All right, I'll take that as a yes. Yes, so let's have the first speaker from the affirmative sides from Weber Street. Thank you.
Okay, and that will be me. Can everybody hear me okay? Does it sound
Yes.
good? Awesome, thanks. Just don't want to have a mute speech for 6 minutes, right? If everyone's ready, then I will begin my speech now. After a long day, feeling exhausted, Mr. Burns lays down for a nap and wakes up with a high heart rate, runny nose, and a painfully dry cough. He is fighting for his life. Every breath feels like a forgotten thought. There is a sense of emergency, alarm. Unknowingly, he could not keep his O2 saturation above 90%, exacerbating his chronic heart disease with compounding factors like morbid obesity. Mr. Barnes reaches for his phone to call local emergency services, laboring for a deep breath. Upon arriving at the hospital, staff are worried whether Mr. Barnes can go. The ICU is full. There is only one ventilator left that is being held for a trauma 1 patient on wait. Mr. Barnes will have to fight for his breath for the next 72 hours as they try to manage dwindling resources. We affirm today's resolution that the COVID-19 vaccination should be mandatory. First, we will address the effects of the pandemic. Next, talk about mandatory vaccinations. And lastly, herd immunity. COVID-19 poses a major threat to people of color. Patrice Peck from The Atlantic states that everyone in the U.S. is at the mercy of coronavirus, and it doesn't discriminate by race, class, or gender or age. And yet, from the very beginning of the pandemic, the virus has exposed and targeted all the disparities that come along with being Black in America. We are dying at 1.7 times the rate of white people from this virus, which means that the toll of these disparities has never been easier to quantify. 19,000 Black people would still be alive if not for systemic racism. For years, Black people have spoken about the struggles that we face, pointing to root causes like poverty, housing concerns, housing segregation, unemployment, and environmental degradation. And for centuries, those concerns have largely gone ignored. This explains the tragic relationship that many Black people have to face every day, not just COVID as a pandemic, but anti-Blackness as a pandemic as well. IPBES expert guest article by Professor Joseph Settle says that it's a human hand in pandemic emergence, yet this may be only the beginning. Although animal-to-human diseases already cause an estimated 700,000 deaths each year, the potential for future pandemics is vast. As many as 1.7 million unidentified viruses of the type known to infect people are believed to still exist in mammals and water birds, and any one of those could be the next disease X, potentially even more disruptive and lethal than COVID-19. Further pandemics are likely to happen more. If we wish to brace for the future, we must take state claim in the fact that vaccines are an important tool to decrease death and displacement of Earth's inhabitants. Current vaccines, like the Pfizer and Moderna one, for example, work through creating antigen-specific memory B lymphocytes that target the crown proteins of COVID-19 virus. Even vector vaccines, like the AstraZeneca and Johnson & Johnson, are effective up to 66% that are more accessible than when provided with the latter that don't require cold storage. This is why the affirmative team affirms a mandatory vaccination effort that works nationally to combat global and local COVID-19 effects that threaten the livelihood of millions of Earth's inhabitants. The word mandatory does not mean that the military officials will be busting down your door to stick your arm, but a system in place where vaccines are a ticket to public goods. If you want to be for the people, you need to walk the walk. These examples of public goods include access to employment, public education, government checks, vaccine passports, pandemic care packages. If you have a medical exemption, of course you'll have access to these things, but mandatory means that more access must be increased to meet demand. This means better clinics and more vaccination times to allow people to get to vaccinations. Not getting the vaccine would result in sanctions on travel, government support, employment, or education. This reflects the trade-off in seriousness of stopping the spread of deadly novel viruses like COVID-19. Another serious topic is herd immunity. Herd immunity is a threshold of individuals required to shield populations from contagion, like superspreader events, aka your best friend's wedding. Vaccines solve by controlling the spread and death of diseases throughout a community. There is no way that we can keep ICU beds open, local clinics open, or healing centers for communities open if everyone is sick. With controlled, slowed infections, resources can be rationed appropriately to each patient, ensuring they get adequate care. This is so we don't get a situation of the lonely ventilator as depicted at the beginning of the speech. According to the National Center for Biotechnology in 2020, we have recognized the significant investments in terms of time and resources that have been devoted to these goals and that the progress has been made, but additional financial support from governments, non-governmental organizations, and philanthropic organizations will require us to fully realize the vision of a world able to rapidly produce millions or billions of doses of vaccines targeted against a novel pathogen like the one we face now. The non-government hustle of the world depends on a targeted approach to a vaccine distribution that can set the world on track to normal without sacrificing those folks that are facing the pandemic. Mandatory vaccinations for COVID-19 mean administrations must pose transparent campaigns that allow populations that have ideological hurdles to this information that could clear up those questions. Without those resources, we cannot sway people that are on the fence. This is important though, because the last push for immunity is what makes a difference from the second, third, and eternal waves of infection, and this differentiates from a complete management of the pandemic. COVID-19 requires herd immunity of 70% according to the Mayo School of Medicine, which is far achievable when compared to the 94% we needed for measles. So we can stop the circulation of disease that leads to catastrophic events. If the vaccination is mandatory, it requires an effort to make the vaccine accessible. This looks like pop-up clinics outside of facilities, mobile vaccination clinics, home visits, and coverage of vaccinations by government entities. Through a focus on accessibility that proposes mandatory to meet the demand of future vaccine rollout, this means that Mr. Barnes gets his ventilator. That is the end of my time. I'm open for cross-ex.
Thank you very much, Speaker. I'd like to first ask you, what do you...
Okay.
Oh, sorry. May I start now?
No, it's okay. So we have 3 minutes for cross-ex.
Okay, cool. Thank you very much, Speaker. We'd like to ask you, number one, what are the limits of the debate? How do you see this debate being limited? First off, in terms of location, are we clear that you're limiting this debate to only the United States of America?
Actually, though we use some evidence that's specific to our origin of the United States, this is something that all administrations in every nation can adapt. That's why we keep the understanding of vaccination clinics more open and broad, and the way that governments control public goods.
Number two, how do you believe this debate is limited in terms of time? Do you feel like a mandate will be best done right now in this moment, or maybe it would be better done in the future?
A timely rollout would be better. There are already approved vaccines that could start now. But over the course of months, we believe that through better investigation of vaccines that are currently paused, then we'll be able to have a rollout that is starts now, and continues into the future.
So lastly, I'd like to ask you why, I'd like to ask you why you believe some people choose not to take the vaccine?
Well, with personal choice, it may be because of religion, or there are some ideological hurdles they have. So some questions they have that they just don't have the time or the energy to look up to or look into, because there is jargon involved in vaccination. So really, it's just kind of about the effort of the people, their beliefs, and if they live in a population or they live in a situation where they have access to the media to understand the range of and the effects of the pandemic.
Lastly, I'd like to ask you exactly when you think that this mandate being put in place would exactly give us, advantage. What is the timeline for this policy to be giving us some results?
Right. I think by 2022, we set ourselves up to have an established understanding of the pandemic, and so we can begin to look backwards instead of looking rapidly or urgently into the future, because there's still a lot of questions to be answered. But by 2022, I believe more things would be open, that we would reach 70%, just looking at from the studies that we've seen and what the media has been telling us.
Thank you very much for your time.
Yep, thank you.
All right, I guess we still have 1 minute. Maybe if there's anyone from the negative side who wants to cross-ex.
Sorry, you said that we're going to go to the next speaker.
Yeah, well, we still have, okay, so now we can go to the next speakers.
Okay, all right,
So
that's
that's the
me.
first speaker from the negative side. All
Thank you
right,
very
your
much.
time starts now.
All right. Thank you very, very much, ladies and gentlemen. I'd first like to take this opportunity to express my gratitude towards iDebate and everyone, Weber State University, and everyone who is taking a part in organizing this event. I'm very excited to debate this motion. My name is Rosinana Mazidro Benjamin, and I'm here acting as the first speaker on side negative. And I'm here to oppose the motion that states that COVID vaccines should be mandatory. Now for some rebuttal. Number one, we do believe that vaccines are good, and we're not here to debate on how good vaccines are or whether they're going to help us fight COVID. What we're against very much in this motion is a mandate. A mandate of the vaccine is a very, very bad idea, which we believe is not going to help us in this efforts towards removing the virus. Our case is going to be towards divided in two places. Number one, they did not really give us a precise timeline for the implementation of this policy of mandating a vaccine. Therefore, would like to consider two cases. Number one, if a vaccine mandate would be implemented right now, we believe this would have detrimental reasons for two reasons. Number one, we believe that there's a shortage of supply. There's very, very few people who have a vaccine available to them. There's very few vaccines. And number two, even the few vaccines that are there are distributed inequitably. Ladies and gentlemen, according to BBC, there's only 2% of vaccines in this world which are being distributed right now are going to Africa, which has roughly 20% of the Earth's population. So we believe there's a lack of vaccines, and also we believe there's an inequitable distribution of vaccines. So number two, we believe that the FDA has not verified or approved any COVID vaccine, and neither has the World Health Organization. The use of vaccines right now is limited to what they call EUA, which is emergency use authorization. So we do not believe what the first speaker of side affirmative said of saying there are plenty of approved vaccines. We actually believe that there's no approved vaccine. There's only those that are being given out as an emergency. Ladies and gentlemen, recently the CDC and the FDA recently recommended the pause of the use of the Johnson & Johnson vaccine only 3 days ago. So we believe that yes, these vaccines might help us and they might have a good efficacy rate. But right now, we do believe that the beliefs of people who do not think that this vaccine will help them, who believe that there may be side effects, who are seeing the fact that the CDC is literally removing one of the vaccines that was given to most people and are saying, hey, maybe these vaccines are not the best that there are right now. Maybe I do not want my children to be given this vaccine. We believe those people have justified reasons to not want it. So therefore, we do not believe that an effort to force them to get a vaccine would be effective or good, no matter how good the intentions are. So now that we've proved how unethical it would be to mandate something that's that's not supplied very much, and two, that's not approved. We'd also like to look in the future. What about if there's approval from the FDA, or what about when there's an increase in supply of these vaccines, right? Number two, we do not believe a mandate for the vaccines is necessary. According to a polling from the NPR/Marists, NPR partners with Marists and made a poll, and they found that they reported, quote, there has been a great increase in people saying they would, the people who say they would never and refuse a vaccine has been dropping since August. Ladies and gentlemen, we believe that there has been over time an increase in people who are actually more willing to take the vaccine. So while in December there was so much misinformation and so much questions regarding the vaccine, more and more people are realizing that some vaccines are better, and some people are more and more willing to get the vaccine. Therefore, we believe that a mandate is not necessary to boost these people to get to herd immunity. That poll has shown that about 70% of people, 69 to be precise, in the US wants to take that vaccine. And so far, 36% of them have. So ladies and gentlemen, we do believe that over time, the demand will increase. And so the necessity for a mandate in order to reach herd immunity is not present, right? And also, we'd like to also attack the efficacy. How effective are these this mandate. According to a study by Asset Reports, there was a conclusion of there being no direct correlation between a country having mandatory vaccine policies and great vaccination number. So even though a country may have a lot of policies towards saying you have to get this vaccine, there's actually no direct correlation. They used 6 different they use different European Union countries and analyze those countries that do have that mandate and realize that those that do have the mandate and do not really show any relationship between the mandate and it affecting the number of vaccine uptakes. It was more saying that the trust people have in the government and the trust people have for the healthcare system is the one that accounts for the increase in people who take a vaccine. And also, we'd like to argue that a vaccine mandate is not justified because of the disadvantages it carries. Number one, there's protesting and an increase in distrust of people have towards like the governments they're in. There's so many different countries where they do not trust the government. They have been robbed of their incomes. They've been overtaxed. There's so many disadvantages that the government has had towards them. They did not trust the government like that can give them back the vaccine. So we're not here to debate whether the vaccines are actually good or valid or will help people, but we're here to debate the rights of people to deny that. And we're here
Time is up.
We'd like to stress the fact that while the vaccines might turn out to be good and effective, a mandate is not necessary. Thank you very much. I'm proud to oppose.
All right. Thanks for the first speaker from the negative side. Do we have, we're going to have cross-ex for 3 minutes. Oh, yeah.
All right, can you hear me?
Yes.
Sweet, then I'll begin my first question. Have they removed or paused the rollout of the Johnson & Johnson vaccine?
They have paused the rollout of the Johnson & Johnson vaccine to assure that the quality is fine.
Okay, is 70% of people in the world agreeing to the vaccine?
Well, we're using different polls to show the world ideas. Like in the developing world, you can't look at the people who want to get the vaccine because the supply is really low. So there are no such polls. But we can see that there's a trending increase of people who are more and more willing to take the vaccine, even in the UK.
Right, but you can't definitively say if it's 70% of people who will accept the vaccine?
Of course, that's not definitely there, but there's no data to back that.
And what country and year was your mandate correlation study from?
It was a poll looking at. You mean the report about the immunization not having correlation with mandates?
Yes, the year and the country.
That was looking at immunization cases for immunization of children. That was done in 2013.
In children, 2013. And do you know what countries by chance?
It was different European countries. There was France, there was Belgium, there was Germany, there was many European countries.
Gotcha. And do you know like the sample size and the survey population of the study?
They did not publish that. They did not publish the exact people who were surveyed. We believe that there was. It wasn't saying the specific numbers. It was looking basically at trends. Is there an increase in people who get the vaccine immediately when there is a mandate? And instead, they explained it using different things like trust people have for the government and trust in the healthcare system instead.
Okay, if the negative believes that vaccines are net good, then why isn't it good to mandate a good thing? And provide
You
it
just
to
say
all?
the negative believes that vaccines right now are not approved, right? They are being rolled out in emergency, but they're not fully approved. Now, vaccines will help us take this pandemic down. But right now, people are not sure that these vaccines will help them, right? They're still very afraid. So the government forcing them to do something will increase that distrust and it will not be effective to increase people actually get the vaccine. So we do not believe that making something compulsory is the best way towards getting it to be done better.
All right, can you explain where in
All
the
right, time is
affirmative
done
that
for
vaccines
cross-examination.
All right, thank you.
Time is up. All right, so let's have the second speaker from the proposition side, from the affirmative side.
Okay. So to start, I wanted to thank I Debate Rwanda for debating against us today, taking the time out of their day. Everybody here watching it, all the other debaters, I appreciate it a lot. I know it hasn't been very easy, but this has been a good debate so far. And I hope that we can continue this cooperation that we have with I Debate Rwanda, even if times get tougher. Okay. Almost 3 million people have died because of COVID-19, and that number can only go up. At this point, mandating COVID-19 vaccines should be without question. If people refuse to get vaccines and they have jobs that could give many more people COVID, then they should not be allowed to go back to work. This is not some like outlandish claim, because many people have died, and the idea that a timeline restricts our ability to to implement a mandate isn't a justifiable reason, because it will forever be the case. Yes, we didn't prepare for COVID, but we didn't expect it, and we weren't able to put facilities in place to be able to respond to COVID in a timely fashion. Yes, the vaccine will get to people much later than it will get to other certain people, and it is racially discriminate. That is true, but that will forever be the case if we never focus on vaccines in the first place. It needs to be corrected, and our evidence from the MCBI suggests that being able to implement many forms implement a mandate would incentivize companies to not only create the vaccines, but to make them more accessible to people all around the world. While a timeline of equitable distribution to people in Africa is at question, it isn't to say that it cannot improve. These non-government organizations will help these people around the world, particularly in areas where they are needed the most. Their next argument about the negative also raised the question about the FDA not approving certain vaccines in emergency cases, but these emergency cases wouldn't have needed to be so emergent if a mandate for a vaccine was already in place before COVID-19 had happened. The question now is, are emergency implementations and emergency uses of the vaccine going to continue to happen? Yes. And mandates should be put into place to force people to create safe vaccines before more emergency cases happen. We need to start preparing ourselves now. If the question is ever, are mandates good or bad, it falls back on the question of whether or not vaccines are good or bad. If vaccines are good, then mandating is absolutely necessary in the face of many people that have already died from the vaccine, regardless of how much the structure of distribution has to improve. Their example about this distribution and emergency cases about the J&J vaccine, this is not an example of failure inside the distribution of mandating vaccines, but it is rather is an example of success, because we were able to recognize the certain people that got those blood clots from the J&J vaccine, and we're able to understand why they got those blood clots, which means the mistake won't happen again. And it's not a total stop of the J&J vaccine. It is rather just a pause for us to be able to correct ourselves and improve this. This is why I've been talking about how we can improve the system rather than just rejecting it in its entirety. Mandating it is absolutely necessary for people that still distrust the J&J vaccine and may or may not have the time or energy to look up the reasons why those actually happen. And 6 out of 7 million cases is far more than any number of people that, or any statistic you're going to get anywhere for people that have died from COVID compared to how many people who have simply gotten COVID. It is just simply better to get the vaccine. Their next set of arguments are about how mandating is not necessary because a lot of people are increasingly willing to get the vaccine. This argument means that mandating can only do good. If people are not resistant to it and people are 100% willing to get it, that means there's not very much backlash from very many people who thinks that the vaccine will be bad. And the only thing that the mandating the vaccines would do is people that are on the fence or people who might have slight resistance to the J&J vaccine are now pushed to get those vaccines, which are good. Which means if mandating is not necessary, that means that the affirmative could never do bad. It could only do good. one of their last arguments is that it's not justified because people don't trust their governments. Well, non-government organizations are the ones that are creating these vaccines and also doing a majority of the distribution for them, such as J&J is not a government-funded organization, but it's still putting out a lot of vaccines, which means that unless they have particular reasons not to trust very particular corporations that are genuinely trying to get vaccines to a lot of people, then there's no reason people should be resistant to those vaccines, even if the government is saying that they should be taking them. The second argument here is that people definitely trust their governments way more than they trust the COVID-19 vaccine or the COVID-19 virus. The virus does not care where you're from, what government you're a part of. It will attack you, and your government, at least to some degree, should be trusted or at least have the benefit of the doubt to still possibly do good in mandating the vaccine. Their last argument and their second last argument are also a little contradictory in the way that they say that mandating is not necessary because people are becoming increasingly willing. And then they simultaneously say that people also don't trust their government. If people are continuing to increasingly trust the vaccine, then mandating it won't matter who is mandating it, because it is a matter of the question of whether or not they want the vaccine, or it should be mandated for people who are unwilling to get them, regardless of who is distributing it or putting in place the mandate.
All right, thank you. We're gonna have 3 minutes for cross-examination. And your time starts now.
Okay, so what do you think is the portion of the population that are actually against the vaccine, according to your numbers?
Yeah, well, it's a little weird for us because as the affirmative, we don't think anybody should really be resistant, but we think that there, particularly in the United States, there are a lot of people who have ideologies to distrust just the idea of getting a vaccine.
So do you think that portion of the population should be dramatized so much for us to actually regard it as a bigger population, as a big portion for us to, I'm not saying not care, but invest in a lot of effort and funds in order to mandate these COVID-19 vaccines?
I mean, if people genuinely believe that the vaccines are good, and like you say, are increasingly willing to get the vaccines, then mandating it shouldn't be something that they're resisting.
What is your strategy for dealing with the potential rioting and non-compliance of the population against vaccines?
Yeah, I think that people will potentially riot, like super right-wing people in the United States. But one, that's also to some degree already going to happen with any policy that we put out. And we also shouldn't be pandering to the idea pandering to the ideologies that people are just against vaccines just because they feel that way. We also feel like the model and purpose of debate is to educate those people, so riots will become far less likely.
Get you. Sorry. Could you repeat?
Yeah. So the first one was that I think that people are going to riot anyway, and we shouldn't pander to genuinely good policies because they just say that they're going to riot. The second argument is that the model and purpose of debate is to educate those people so they'll be less likely to riot anyway.
Okay, so last question. Why do you think the people who are hesitant are actually hesitant to get the vaccine?
Yeah, so I think Jordan and I have been kind of dancing around this question because it's frankly a little embarrassing, because in the United States, there are people who are genuinely resistant to the vaccine because they genuinely believe they distrust the government will track them. They have no real reason to think that in the United States. I understand that outside the United States, that governments have done genuinely bad things and there's reasons to distrust them. But those people are kind of what the negative, I think, should be outlining for us to target, to educate and give them reasons why they shouldn't be resistant to mandating the vaccine.
All right, time is up. So let's have the next speaker from the negative side. You have 6 minutes and your time starts
All right. Can you all hear me? Just a thumbs up would be nice.
Yes.
Yeah. So if I need a shot to fly, I'd rather drive. If I need a shot to eat, I'd rather starve. Says one of the YouTube commenters, the COVID-19 vaccine mandate policy. I am proud to negate. In this debate, a few things. I'll first off refute a few of the questions or the points they've laid down to the table today. And secondly, I'll explain further how unnecessary the COVID-19 vaccine mandates are, how ineffective they are, and how even if they prove to us how effective the mandates could be, it's still unjustifiable. And all this through a cost-benefit analysis. But first, a few of the points that they brought to the table. So one, the first speaker comes here talking about how to reach herd immunity, it will require 70% of of people who are vaccinated. But at the same time, the NPR poll shows that we have 36% of the population of the United States already vaccinated, 34% are willing to be vaccinated, 25% don't want to be vaccinated, and 5% are just hesitant. And now, by math, we know that 36 plus 34 would automatically give us a 70%. Now, why do we think that a vaccine mandate in this case won't be, won't be necessary in the first case? It's because one, we believe that there is no supply. There is not enough supply to meet the 34% demand, which means that the problem here is not it's not about us wanting a mandate or not, it's us not having the means to have a mandate, because you cannot mandate something of which the doses are really small. Now, they also came here talking about how we shall have further pandemics that are likely to happen. So that's why they want to initiate the mandate, but they never gave us clear reasons to predict such a thing. And secondly, they never gave us reasons to show how mandating the current vaccination plans will help eradicate a future anticipated virus. And now they also talked about how people of color are dying, how they are now marginalized more, how very many people have died. But at the end of the day, they never understood our stake. We talked about the fact that we are not against the vaccines themselves, all right? We're not against, people getting the vaccine. What we are against is the method of the vaccination plans. We showed you how one of the reasons why we don't believe that a mandate is possible right now is because these vaccines are not fully FDA approved. So at the end of the day, we don't believe that we shall have a mandate. A mandate is not possible without full FDA approval. And secondly, the supply is still low. So they never tackled that part very well to show us how exactly we shall have a mandate in those two situations. And now we give them my first speaker talked about how we shall have a second case in this debate of talking about how even if they showed us how possible it would be, which they didn't, we shall have three problems there. We shall talk about how unnecessary it is, and we still stress on that fact because one, we talked about how we shall give time to this thing, all right? We just need time in order for us to be able to, have full or surplus supply of the vaccines that are already working, and also the people how that supply needs time in order to meet the demand that is there, in order to reach the percentage that themselves gave us of 70% of the citizens that are vaccinated in order for us to reach herd immunity. We gave them examples of how ineffective these mandates would be. We gave them an example of a study by Asset Reports that showed how there is no correlation between a country having mandatory vaccination policies and greater vaccination numbers for immunization of children in Europe in 2013. And at the same time, we would like to correlate or use the same reasoning to extend this to COVID-19. we saw that there seems to be sentiment among those that don't want the shot, and the government forcing that one on them won't necessarily mean that they will get one. Instead, we believe that the people's motivation to update the vaccine is determined by the efficiency of the health sector and the political environment. Even though they agreed otherwise, they disagreed by saying that giving an example of the Johnson saying that it's a private company doing that, but at the same time, we believe that that's enforcing more public skepticism and spreading anti-vaccination rhetoric, because one, we believe that people already know that this is all about privatization, so these people only want money, so that is increasing public skepticism, and it's not increasing the people are actually getting the vaccination. And in the end, we believe that for them to have an effective mandate, severe measures have to be taken. Mandating the COVID-19 vaccines will likely impose threatening the livelihood of the people who don't want the vaccine. In the end, threatening the livelihoods of the people they are for. They are for the people who are marginalized, who are dying. But at the end of the day, if a portion of those of the same people they're trying to protect doesn't want the vaccine, thinking because of the various misconceptions about it, we believe that in the end they are the ones that are killing their own people through the recruitment method, and then in the end, we as the negative side believe that we have a great importance. The vaccine has a great importance to help eradicate, but in the end, the strategies of vaccination plans today have no room for a mandate. Yeah.
All right, so thank you very much. We're gonna have 2 minutes for each of the teams to prepare for their closing speeches, and then we'll be back. So yeah. Oh, sorry, we were supposed to do cross-examination. Sorry for the mistake. Yeah, so let's have someone from the affirmative side. Yeah, so you have 3 minutes for cross-sex and your time starts now.
Okay, sweet. My first question is about the quote at the beginning of your speech that talks about if you need a shot to eat, you'd rather die. My question is hunger contagious? Hello?
I think maybe you can repeat the question. Maybe they didn't hear it, I guess.
I'm gonna wait a little bit. Is it Audrey? On my screen, it shows you're attempting to speak, but I can't hear anything. Like your box lights up, but I can't hear anything.
Audrey, can you try muting and unmuting? Because she's unmuted. Maybe it's connection issues.
I couldn't hear anything.
Oh, there we go. I can hear you now. Can you hear me?
Yeah, I can. You can
Okay.
ask your question.
Perfect. So my first question is about the quote at the beginning that talks about if you need a shot to eat, you'd rather starve. But my question is hunger contagious?
Is hunger contagious?
Yes.
So the first thing that I would like to talk about on that point is that this was a frustrated YouTube commenter who was responding to the COVID-19 vaccine mandate policy, where he was expressing his frustration to this policy, because he believed that he shouldn't be the testing machine and would rather starve instead of getting that shot to eat. So your question of saying that hunger is contagious, it depends. So
no, I know, but I think my question is rather, why should we just allow other people to risk getting COVID because we feel that we don't want the vaccine?
Now that's where I gave the point of side affirmative dramatizing the portion of the people who don't want the vaccine. So we talked about since the beginning in my first speech, in the first speech, we talked about how with time these mindsets will be eradicated, and that's the time that side affirmative not giving these people who think that they would rather stop instead of getting that shot to it. All right. So we believe that giving this thing time instead of mandating it right now, forcing people to understand this thing in a short time, and giving better educating and sensitizing campaigns that have greater long-term impacts would be much better than mandating it right now and limiting them and putting all those restrictions on them just right now.
Okay, that makes sense. My next question is, what countries or where are the vaccines not equitably being sourced to?
You could talk about the countries that do not want the vaccine in the first place, that are against the COVAX initiative, which is Tanzania and Madagascar. You also talk about how the vaccine inequitable. In our first speech, we talked about how only 2% of the doses around the world are in Africa, and Africa upholds 20% of the artist population, which is like a big portion of, and if you have few doses, that it means that the vaccine distributions are really inequitable, and mandating such a thing would mean that we are at a disadvantage and not justifiable in the end.
Okay, my next question is, what kind of methods do you suggest we put in place to create more equitable distribution to Africa?
And now
right,
that's where time comes in. We just have to give this thing time in order to have surplus supply in developed countries, where at the summit, where we shall be able to have even better donations from developed countries to countries in the developing world, such as Africa. So in that case, we shall have better international relations and better, equitable vaccine distributions.
Okay.
All right, time is up. So now I guess we can have the 2 minutes for each of the teams to prepare their closing speeches. And then from there, we'll dive into the closing speeches. Thank you.
Sorry, Bangali, which side begins the closing speech?
Sorry, I didn't hear you. Did you say?
Which side begins the closing speech?
The negative side.
Right.
All right, the 2 minutes just got done. So let's have the closing speech from the negative side. You have 3 minutes. Your time starts now.
Thank you very much, ladies and gentlemen. I'm here back, Joel, and I'm here to give the closing speech. So right now, in a policy debate, right, we have side affirmative coming here and giving us something that is new. So number one, they have to tell us why they're doing it. Number two, whether it's actually new or whether it will just happen in the future. And number three, they have to give us a plan and show how it solves the problem they stated. Now, ladies and gentlemen, this time they really spent a big portion of their time spending it on why they're doing that thing and not explaining how they're doing that thing. And that created problems. They did not give us a plan showing when a mandate will be put in and where specifically, and like funding all those problems. So that led us to creating our own case. Number one, we say that there is we're going to look at two cases, if it's in the present or if it's in the future. We attacked them on the present, stating that the supply is still low and the vaccines are still not approved, and they did not really give us a good response. So we decided that we want those two arguments. The only thing they rebutted is by saying that J&J is actually fine and they learned from their mistakes. But we're never saying that the vaccines are bad. We're looking at the optics. How does it look to people when they see a vaccine that they saw administered, then being repealed or put on pause? That does not restore their trust in a government, which is why a government forcing them to do something in specific, forcing them to get that vaccine is not helping them get their trust, which is not leading to more vaccines being taken, simply. And then we looked at, in the case of the future, what about if we have an approved vaccine and there's enough of it? We talked about two main arguments. We simply say that one, it is not necessary, and two, it is not effective to put a mandate. Number one, we said it's not necessary by simply showing a poll that suggested that 70% of people in the US are willing to take up the vaccine. Then they asked us the question about whether that applies for the rest of the world. But then when we turned around and said, hey, we do not know the stuff because the rest of the world doesn't have enough statistics. So we told them, what about you? Do you have any other statistics about the rest of the world? Then they simply stated that they're looking at it in terms of the US and trying to use the US maybe as a case study or as an example, which we can continue to use throughout the debate in order to show growth around the world and like trends. So therefore, we believe that we're justified in taking up this study and saying that it wins the point of it not being necessary, because herd immunity will be achieved by the trend that's going on, which is that 70% of people are willing to take the vaccine, plus it's also increasing over time. But then we had the problem of them asking us, well, what about you guys saying that something is increasing, the demand for the vaccine is increasing, but then a mandate would be a decrease in the vaccine demand, right? They asked us, well, how do you reconcile those two things? Whether if something is really
Time
increasing,
is up.
if more people are willing, we showed them that it's not necessary and effective to put a mandate, and so we believe we took the debate. Thank you very much.
All right, so let's have the closing speech from the affirmative side.
All right, let me head over to my document. Okay, is everyone ready? If I hear no, then I know I'll wait. Okay, sounds great. There is no time for Mr. Barnes. We have had a year in distress. It is time to resolve the matter. At the end of the debate, the AF reminds you that COVID-19 is a specific and significant threat that is disproportionately affecting the members of society on the margins. This debate comes to the belief of people should be required to do a good thing. Don't forget that the negative starts their speech conceding the ethos of vaccination is a good thing. It is very suspect how they try to discredit vaccines that they claim to support. Mandating is necessary to prioritize improving a system that relies on reactionary emergency approval policies. Say that 5 times fast. Their mandate study sits wrong with me because it's very old and doesn't account for the events of COVID-19. The negative proving that there is pools of people that will and won't get the vaccine prove that we need mandates for the people who will not get the vaccine. Like my partner said, if the negative is right about more people are okay getting the vaccine, then the last percentage is crucial, and the people who will not be getting the vaccine to reach us to get to 70% to allow us to have herd immunity. We use this through bracketing access to public goods like travel, public education, and government subsidies, which was never attacked throughout the debate, meaning the method could potentially be put into place. Vaccines are effective and work. Herd immunity allows even those allergic to vaccines or too immunocompromised to be shielded from contagious events like pandemics, an objectively good goal to strive for. Mr. Barnes needed a safe future. Black, poor, and older people need to be immune. We let them down by valuing personal choice over transparent and mandatory vaccination campaigns. Our Nation Center for Biotech source confirms that non-government and government sources are building infrastructure to ensure millions, even billions of doses. Severe measures are actually not necessary when you leverage access to public goods. The next mandatory requirements for vaccination mean that governing bodies must meet specific demands necessary to facilitate herd immunity. Without mandatory as a signifier for success, the approaching COVID-19 pandemic will never reach an adequate amount of threshold to protect the most vulnerable populations. The vaccination is necessary, and the affirmative uses tools that are good to do good. That's why government mandates work. A reminder that vaccination has the power to wipe out imminent threats to people's lives. Smallpox has been eradicated due to the persistent efforts of vaccination. For those on the call, soon to be vaccinated or still on the fence, we hope that today we have made some arguments clearer. Live your life, do it right, wear a mask, get vaxxed. They talked about how, the negative drop this part about using public goods, which are able to outperform our method that mandates vaccinations by not allowing access to things like travel and public good. We have only been able to eradicate smallpox, which means that 70% is crucial, and we've only done it once. It requires mandates to actually get to a place where we are able to reach herd immunity. This is why it is specific and necessary to affirm the resolution that the COVID-19 vaccination should be mandatory.
All right, time is up. Thank you for all the speakers that attended the debate, both from Rebel State and from iDebate Rwanda. We're glad to host this debate. And before we go to the closing remarks, I just want to open this time for a Q&A session from the people watching us, from the audience. So if there's anyone who has a question or a comment about this motion, this is your time. So yeah. So if there's anyone, you could just unmute yourself and share something.
I have a question.
Yes.
So the question goes to the proposition side. If I had the debate correctly, my problem is with their timeline, right? The opposition side asked them if when they intend to implement this policy of mandating the COVID-19 vaccines, and they say now going forward. But then the opposition side presented that there was limited supply. There's not enough supply to go around. And if you're mandating, if you're making it a must for everybody to go have that vaccine, yet there's not enough to go around, how is that supposed to work? I don't find it practical. And also the fact that these vaccines do not have FDA approval yet. There is very limited data on like their long-term safety, and forcing millions of healthy citizens who find themselves having an acceptably low risk of getting COVID-19 is just not ethical to me. Yeah, that's my question. How practical is this plan of yours, and is it ethical given that the vaccines are not FDA approved and there's still need for more information to see how effective and safe they are? Thank you.
All right. Any answer from the affirmative side? Jordan?
Yeah, I can start by answering that question. It was a good point they made. We have some evidence that suggests that there are lots of institutions that are non-governmental and that are governmental, that are philanthropic, like Dolly Parton in the US donating millions of dollars to get a vaccine, and that they are creating millions, shooting for billions of doses. And so that evidence just disagrees with we're short on supply. But the overall risk of like emergency situations and approval, we think outweighs because that is the burden of an emergency, right? You have to make decisions that are that risk at some point, but we outweigh that overall threats to pandemics that see no color lines but still disproportionately affect those that are poor or older, the race, anti-blackness, the way they experience the world, that outweighs because that just like is one thing to eliminate that already pits them against a really hard and difficult world. But yeah, my answer. Bailey, do you have anything to add?
No, I think you got it.
All right. Any question from any other person? As usual, you could just unmute yourself and ask a question. All right. Okay, I think there is no other question. And please, if you have any question, you could just text it in the chat box. We'll read it later. I think so. Now let us have Mr. Samuel Allen, for any remarks, notes, reflection on the debate. So Samuel, you're welcome.
Thank you. I appreciate it. I appreciate you doing all the work to hop in and get this hosted. Also, I thought this was a great debate. Y'all did a great job. I really appreciate everyone putting in the work to put this together. And for me, it highlighted the complexity of the problem at hand. You know, one of the things that Joelle and Audrey, I appreciated about your question and the cross-examination was, why do you think people are resistant to the vaccine? And I think that you all unpacked a lot of the layers of what's going on there, that there's more than just conspiracy, which is prominent in at least US media, but concerns of access. I thought y'all were really thoughtful about articulating the problems of a mandatory policy if you don't have access, and thinking about access as part of the problem. As one of the things that I also sort of appreciated was everyone trying to get to this idea of herd immunity and the ways in which that 70% figure might statistically, maybe people right now want to get there, but what happens when maybe the fear resides or recedes a little bit might change the way that a snapshot of a poll could assess some of that. And so I thought that was another really interesting part of the debate, where we're trying to figure out which populations we need to add up to be able to actually get to that herd immunity. And I think that that's where part of the complexity of it really resides. I just want to commend everyone on an excellent debate. I just can't say enough about what I think of students in the middle of this very pandemic that y'all are talking about, putting in the work to argue about it, because the emergency is upon us, and I really think that y'all did an exceptional job. And I just want to say thank you to iDebate Rwanda for making these platforms possible and this exchange possible. So thanks, everyone. And I'm happy to ask or answer any questions if you have them for me, but I thought this was really a wonderful demonstration of what debate can do to add complexity to the conversation. Thanks all.
All right, thank you. I totally agree with you. This was a great debate and very insightful from both sides, given that we're like some kind of different worlds, and having views from your side, views from our side is very great, the art of civil discourse. So yeah, for those who might not know about iDebate Rwanda, we're an NGO that works with the youth of Rwanda with the vision of enhancing critical thinking and public speaking skills among the youth of Rwanda and the youth in the region. So part of our programs, we have a lot of programs, but all of them are centered around that. And one of them being the US tour, as I repeated again, is one of the ways we met with the guys from Weber State University. Since then, our relationship has been very great, and we hope the best for both of us, and that we move to greater heights. Yeah, so this was a global debate series. We usually have it like with different universities, and basically all we want is like to have discussions about things that matter to our society. Like for example, for the vaccine, for sure we all know that it has been like a great, it has been like a big thing that has been like going around. Some people saying that the vaccine is not safe. Other people are saying that it shouldn't be mandatory. If it's mandatory, then how are you going to work on the supply that is well known, that is little and all that stuff? So I think it was really a great discussion and very, very, very insightful. So I just want to thank everyone that came into the call. Thumbs up to you, and we hope to see you soon in like more of our events that are coming up. So unless there is like any concerns or any questions, remarks from any of the speakers, this is your floor now as we end this event. But really, thank you for everyone to be here. All right.
Good job all.